confidence. Just to say a couple of other things that are happening, we have a sub-study which is looking at perioperative TOE. So a small number of patients are having a TOE in theatre before their surgery and then after their surgery to look at right ventricular dimensions and volumes, because I think that will be interesting. And as I alluded to, we're doing a discrete choice experiment to really understand why patients choose one operation over the other. And this is just to kind of add to the picture and the story of pectus excavatum. Data acquisition and validation will be complete by December. We'll lock the data at that point, early January, and we hope to have an answer by spring. And so by May, April, May, June next year, we hope to be publishing this data. So really exciting. I think this is a really important study for patients. It's going to, for the first time, provide some really clear evidence of the risk and benefits in an RCT setting and help them decide what they want to do when they have severe pectus, which is causing symptoms. It's going to have significant impact internationally in terms of funding and commissioning. We know that in the UK, that's what's going to drive commissioning guidance going forward. So I think a really important study, and I hope you're all excited.